Module 23, the aging athlete. What are the macronutrient requirements? Well, it's recommended that greater than 55% of total kcals come from carbohydrates for about 5 grams per kilogram of body mass. The selection of food should come from complex carbohydrates and low glycemic index foods, things like starches, bread, cereals, rice, pasta, potatoes, all fall under this category. That's going to provide the athlete with protein, vitamins, minerals, and of course fiber. About 25 to 30% of total kcals should come from fat. Less than 10% of total kcals should come from saturated fat because of the concern for cardiovascular disease. 10% should come from PUFAs, that's the polyunsaturated fatty acids. 10 to 15% coming from the MUFAs, that's the monounsaturated fatty acids. If we drop below about 20% of total kcals for fat, then that's actually going to impair the absorption of fat-soluble vitamins, so we do want to be careful here as well. As far as protein is concerned, greater than 10% of total kcals should come from protein. According to Evans and his work in 1995, 1 to 1.5 grams per kilogram per day. There is some caution, of course, with impaired kidney function. There may be some calcium loss and atherogenic of the diet, so safe consumption of protein here. Intakes of about 1.2 to 1.7 grams per kilogram per day seem to be safe for this population. What are the micronutrient requirements? Well, as far as vitamins are concerned, of course, we want to get vitamin A. We want to be careful because of the toxicity problems associated with consuming the active form of vitamin A. That's retinol, retinal, and retinoic acid. That could also suppress the immune system with supplementation. So the safest bet is really to consume the precursors, which are things like beta-carotene. As far as vitamin B6 is concerned, you may actually need about 2.0 milligrams per day, according to some work that was done in 1999. As far as vitamin B12 is concerned, about 2.4 to 2.8 micrograms per day, again, according to some work that's out there. Vitamin C, it seems that there is no change necessary for that particular vitamin. Vitamin D, about 10 micrograms per day in individuals greater than 51 years of age, and about 15 micrograms per day in individuals greater than 70 years of age. Supplementation may actually be warranted because of the difficulty in getting vitamin D in the diet and also less exposure to direct sunlight. As far as vitamin E is concerned, there doesn't seem to be any sort of change that's recommended there. For riboflavin, or B2, about 1.3 milligrams per day for females and about 1.7 milligrams per day for males. And for folate, through food sources, not supplementation here, we're looking at about 200 micrograms per day, simply because of gastric atrophy and then the reduction in stomach acid that comes along with a reduced size of the gastric cavity muscles. As far as minerals are concerned, calcium about 1,500 milligrams per day. Iron, the stores actually increase with age to about 10 to 15 milligrams per day is what's necessary because of that. Zinc, we're looking at only problems in endurance athletes, at least according to some of the recent literature that have very high sweat rates. And if the athlete is consuming a high carbohydrate diet with a high phytate content, so about 15 milligrams per day is recommended in those individuals. As far as water recommendations, we know that overall there's a decrease in total body water. There's a decrease in antidiuretic hormone or vasopressin efficiency, which means that there's going to be more water that's excreted. We also have a decrease in the sensitivity of osmoreceptors that sense thirst. So there's going to be a decrease in thirst sensitivity, and that sensitivity loss is coming from hormonal changes as well as not being able to detect the electrolytes through the osmoreceptors. There's also a decrease in blood flow due to decreased vasodilation in aged skin. That reduces to about 25 to 40%, so that's pretty substantial. There's going to be a decrease in sweat production as well as a response in the onset of sweating. So this person will build up more heat compared with a younger person, and therefore they won't start sweating till a little bit later on, which can be dangerous. As far as intakes are concerned of water, before exercise, about 500 milliliters or 17 ounces. During exercise, 600 to 1200 milliliters or 20 to 40 ounces per hour. about 150 to 300 milliliters or 5 to 10 ounces every 15 to 20 minutes of activity. After exercise, we want to base it on the amount of body mass loss. So we do want to measure the person's body mass before they exercise, and then they're recommended to drink 150% of the fluid lost based on their body mass lost. What are other considerations here? Well, we always want to consider chronic disease or illness across the board, and particularly with the elderly, this is going to increase in prevalence. So with arthritis, we are concerned with the ability of that person to prepare their meals, to have good dexterity, and of course mobility. So we want to emphasize healthy meals and snacks from the supermarket. Simple, nutritious meals that don't require a lot of cooking seem to be the best way to go. Perhaps takeaway and frozen meals are a good option, and there are also home-delivered meals that can be an option for some individuals as well. As far as dentition is concerned, we do want to be careful with acidic drinks like sports drinks, soft drinks, fruit juice, and wine, because that can lead to tooth enamel erosion as well. Social interaction is important because that could be the motivating factor to remain active. Taste and smell changes here. Alcohol can actually stimulate appetite, so drinking in moderation, so 2 drinks or less per day is what's recommended there. Perhaps that can help with appetite if someone's having a problem with that. Nutrient density should be the emphasis. So the energy requirements are going to be less in the elderly. However, nutrient need is going to remain the same. And good news is that if you do have an elderly person that is more active, then they can consume more kilocalories, which then makes it much easier to get all of the nutrients that are necessary. We, of course, want to monitor medications, especially things like polypharmacy for the interactions among all of the prescription medications. We want to look at drug-nutrient interactions. So are there any medications that the person's on that then any nutrients in the diet might affect? When is supplementation necessary? Well, if the person cannot afford good nutrition, that's a big concern. If there's a lack of appetite, if there are any illnesses that occur. The avoidance of any specific foods can also be problematic because that could lead to nutrient deficits. Any diet insufficiencies overall, or any food insecurity or loss of function or dieting or disinterest in food. Habitual substance use could be illicit or even over-the-counter abuses. Smoking, alcohol, drugs, these are all things that are important in order to monitor even in the aged athlete. What are elderly nutrition programs? Well, the government has programs that can actually help meet the nutritional needs of the elderly. The USDA has the food stamp program. They have adult services food programs. They have nutrition assistance programs for seniors, or NAPs. They have Meals on Wheels and home-delivered meal programs. There's a senior nutrition program of the Older Americans Act. And there are also local non-governmental programs as well. So these are all things that we should be aware of if we're working with this particular population, so we can make good recommendations for sound nutrition.